Hi, team. Thank you for joining us. I think we can now officially kick off the webinar. Thank you. Over.
Yeah, thank you so much, and good afternoon all from East Africa. My name's Lemi Medad Mabuga. I work at ECSACONM. ECSACONM stands for the East Central and Southern Africa College of Nursing and Midwifery, and I welcome you all to this wonderful commemoration. It's a virtual commemoration of the International Nurses Day with our theme, which says our nurses, our future, the economic power of care. Next. So we have the agenda for our commemoration. We will have opening remarks and objective, ECSACONM overview. I will take you through that. Then we'll have great speakers who will take us through the panel, presentation and discussion, and we'll have question and answers. We'll have special announcement and vote of thanks. Next. So I will leave the objectives and I will leave them to our moderator, George, but I would like to go through the overview next. Yeah, so I know most of us understand or they have heard about ECSACONM, but I would like to remind ourselves. ECSACONM, it's a professional body for nurses and midwives in 17 extra regional states. So our 17 countries has joined recently, which is Ethiopia. And we are proud of having Ethiopia on board. ECSACONM is a college without walls. It aims for strategic collaboration and professional excellence. And it's a baby of the Ministers of Health because it was formed and approved by ECSA. ECSA stands for the East, Central, and Southern Africa Health Ministers Conference in November 1988. So you see, we are in existence for many years now. It's more than 30 years. We are around 32 years in existence. Next. And these are the member states. You see the map. So ECSACONM structure, we have a structure which consists of General Assembly. General Assembly means all the entire membership. So we have individual members who are nurses and midwives. Then we have the Council of National Representatives. In short, we call them CNRs. Each country has a national chapter. So our countries, our member states, we don't call them by names. We say Tanzania, it's a chapter. Within the chapter, they have the same committee which functions within the chapter, but we also have the same structure at the region level. So the CNR is the functional organ of the college through which its policies and decisions are made. In ECSACONM, the elections are held every after 4 years. And the current leadership, they came into office during the Eswatini conference that was in 2022, and they are going to end in 2026. So it's a 4-year positions, then we give opportunity to other members to come and lead the college. Next. And we are having our brand, which is ECSACONM Conferences. And this year we are going to have another biannual conference in Lesotho, Maseru, and with the role of evidence-based practice and innovations in nursing and midwifery in combating emerging and re-emerging pandemics. And we have sub-themes, you can see them, that we've opened for submission since last year in June, and the closing will be end of June 2024. So ensure you submit your abstract to get slots to present during the conference. We need to hear the good innovations, the research, the quality improvement initiatives that are going on in our facility, but also in our countries. So early bird registration, which goes up to this next month, June, you have to pay 150 if you are a non-member, you pay 250. And non-members who are outside the region, they pay 400. So we encourage nurses to join ECSACON as members to get the benefit of the paying the 150 instead of paying 250. Next. Yeah, so the membership at ECSACON, as I told you before, we have individual members who are nurses and midwives. But we also have regulatory bodies across all our member states. They are also part of ECSACON members, and they pay their annual subscription fee to maintain their membership. We also have the Nursing and Midwifery Association unions. They are also part of ECSACON members, and of course the individual members. To register, to become a member, you can visit our website, www.ecsaconm.org. Please visit our website. We have more information regarding the conference, how to register for the conference, how to become a member, and the fees down there. For the new, you have to pay 50 USD. And this will comprise $30 for joining fee and $20 for annual subscription fee. And you have to pay every year to maintain your membership. Next. So ECSACON is not working in isolation. We work with partners. And today we have one of our good partners, American Academy of Pediatrics, who is going to participate and give experience of collaborating with ECSACON, but also working to improve the nurses and midwifery skills. We have AMREF, they are supporting us on issues of knowledge management. I'm happy to say they are part of this event because we did it in partnership, in collaboration with AMREF, very close collaboration. We also have other partners, as you can see. Japaigo is also our good partner, but all these also. But we also work with sister colleges. We have COSEXA, College of Surgeons, College of Obs and Guy. It's called ESCOG, CANEXA. These colleges have advanced more in training. They are professional into high level, so we really learn from them. So we call them and we learn together to take through ECSACON in training perspective. Next. So these are the same partners I've talked about. And I would like to inform our partners who are nurses and midwives that we've already launched our fellowship programs, which are equivalent to master's level. And for now, we have students or learners or trainees in chronic disease management, critical care, midwifery. And in September, we are starting the neonatal care program. And we have partners that we are working with. to ensure these trainings are at the high standard. Like the neonatal care, we are working with COIN. I'm sure most of us have heard about them, to ensure that we have that high level of content, but also the ones I've mentioned, we did work with other external technical partners who helped us to come up with this content and the fellowship programs. We have the upcoming. When I say the upcoming, it means the curriculum are ready. We are just waiting to submit them to the regulatory authority so that we start training nurses on anesthetic care and perioperative care. We are also planning to start new programs, and we'll start by developing the curriculum for these programs, and they are part of our current work plan, which is oncology, nursing education, pediatric nursing, leadership, and management. We want to provide variety of course or technical areas that nurses can go for and become specialists in that area. Next. Thank you. I think that's the end, and I'm happy to welcome Mr. George Capillo, who is going to moderate this session or this event. Karibu, George.
Thank you so much, Lemi. Thank you, everyone. Let me take this opportunity to welcome you for this dialogue session. We are glad, we are humbled that you've gotten time to join us for this particular dialogue session. And at this point in time, I'm just going to be able to introduce my panelists, the panelists that are going to take us through the dialogue session proper. Maybe before I get into the introduction proper, as we are waiting for the slide to be up, I would want us to just speak briefly to why we are here. We are actually piggybacking on a very important occasion that happened for the nurses fraternity on which was celebrated on the 12th of last weekend, which was International Nurses Day. And all of us know that the theme of that particular day or that particular celebration was our nurses, our future, the economic power of care. So we are piggybacking on that and continuing the discussion on how then are we able to harness the economic power of care with regards to our nursing fraternity and with regards to the good work that nurses are doing. We know that despite being the backbone of healthcare, nursing often faces financial constraints and societal undervaluation. So our discussion in this context is what is our role as ECSACON and ECSACON membership, and how then do we fit into the scheme of things. So with me for this particular discussion is a group of highly experienced panelists who will be able to take us through a deep dive on these particular issues as we are going to delve into them one by one. Our first panelist that is going to take us through a deep dive over a very critical part of our discussion is our president, the president for ECSACON, Madam Glory Msibi. So I would give the floor for Madam Glory Msibi to say hi, if you can put your camera on, and then we go deeply into the issues at hand. Madam Glory, are you able to put your camera on?
Thank you, George. My camera is on now. I don't know if you have given me the floor, or you are still going to give me the floor.
Yes, I'm going to give you the floor. I wanted to test if your camera is on. Thank you so much, Madam Glory. So like I was saying, we are having now the deep dive proper into the issues at hand. And like I said, Madam Glory is going to take us through a little bit of what are the key things that are looking forward and backward and currently in terms of what ECSACON has been able to do in terms of advancement of nursing and midwifery education and practice as the president or as the driver of this engine called, of this machine called ECSACON, where are you seeing ECSACON in the next decade with regards to empowering nurses economically? And as you take a deep dive into that, Madam President, maybe you also just touch on strategies that you believe are essential for promoting economic empowerment of nurses and midwives, by also highlighting substantial and often under-emphasized economic values that nurses have, especially within the ECSACON region. So I give you the floor to take a deep dive into that, Madam President.
Thank you very much, George, and good afternoon, colleagues coming from the East, Central, and Southern Africa. We welcome you to this important but very engaging discussion, whereby we are looking back and tapping on the theme of ICN, which says nurses, which talks about nurses and the empowerment of them. So basically, as ECSACON, like Lemmy has alluded to, we are a college of excellence in the East, Central, and Southern region and beyond, because we are looking forward in attracting even countries that are out of the ECSA region with what we are doing as a college. And of course, our mandate, we know that it is to strengthen the nursing and midwifery professions in the region in 4 areas which are very strategic to the college. Because when the leaders or the ministers founded the college in 1990, there was this age of saying health for all by the year 2000. And for them to do that, they realized that they cannot do it without the nurses as being the engines of the healthcare system. So that is why ECSACON was launched in 1990, because the aim was to meet that target, which was health for all in the year 2000. But basically, what we are saying as ECSACON, as we strengthen our college, we're looking forward to empowering nurses in terms of education, and practice, research, and as well as leadership and management. We are aware that the countries that we are coming from, all of us here, they do provide programs that are undergraduate or diploma and certificates. But as ECSACON, we have realized that there is a challenge in most of our countries when we want to further your studies and do your master's degree. And probably, if I can give you an example, in the Southern region part, most of the programs that are offered at master's level, they are offered in South Africa. And for these countries to register their nurses in these institutions of higher learning in South Africa, it is very much cumbersome. So ECSACON is coming here to say, here we are, a college that is responsible for the East, Central, and the southern part of Africa, and we want to empower nursing and provide the need that has been found in all our countries. And basically, when we started this programs, we did some needs assessment as a college, and the findings showed us that there is shortage of human resource in the different kinds of programs that Lemmy has just highlighted before. And we then decided to start with the 4 programs, because one may wonder why the chronic disease management yes, we are looking at the chronic disease management, because the shift now, when you look at the health of our communities, a lot of people are having a non-communicable condition. So we are trying to respond to that. And of course, the critical care, when you remember during the COVID-19 time, all the countries, they were found wanting in terms of skills that were supposed to be available during that time. So even now, the skills that we are having in that area, they are not enough. So that is why we came up with these programs. And like she has alluded to, that we are hoping that we want to expand even more and have more programs in place, so that we have a variety of programs that are offered by ECSACON, but programs that will respond to the needs of our countries. And once we do have these nurses who are well prepared and competent enough to provide this quality healthcare, nursing and midwifery services, then you are assured that the quality of services that will be provided by them in their various countries will be of high quality. And that itself, it becomes an empowerment to the nurses, because once they do that, the economy of the country, because most of the people will be well at that time, will be high. So, and again, we are also promoting research in for our nurses. Yes, one of our pillars is research, but we have since realized that we need maybe to up our game and train nurses on research skills and methods. And of course, we have partners who are assisting us in that regard, so that the research that they are conducting, it becomes an instrument that will inform policymakers, that will also inform education, that will also inform practice, that will also inform leadership and management. And again, the last pillar of leadership and management, yes, this one, from the little survey that we did, we found out that in most of the countries, our governments are complaining about the management and leadership skills of our nurses. So it is very important as ECSACON that we develop a program that will speak to that. And this program, and as you understand, these programs are not only theoretical, they are practical. We want to make them as practical as possible, because these nurses are at the practicum area, or even when they are at policy level, it becomes practical for you to make a decision. So it is important that we train these nurses on practicums. So maybe going to the next question, George, I don't know if you want me to go towards the next question.
Yes, as you are coming in, and probably just to wrap it again for your contribution, I wanted to add a little bit of question, so that you add it with the one that you are going to answer next. My thinking is this, Madam President, there is a bit of when we come to policymakers, healthcare administrators, and even general public, they are always often they are unaware of or are misinformed about the return on investment that adequate funding in nursing can provide, especially in financing turbulent times such as this. Drawing from the lesson that you have from the lessons that we have from COVID-19 pandemic, and recognizing the increasing threat to health of populations around the world due to conflicts, climate crisis, and financial instability, what would you highlight would be ECSACON's role in advocating for shift in perspective of policy?
Come again, George. The last bit.
Yes, the last bit is I'm saying drawing from the lessons that have been that have been learned from COVID-19 pandemic, recognizing the increasing threat to health of populations around the world due to conflicts, climate change, climate crisis, and financial instability. What would you highlight as ECSACON's role in advocating for a shift in perspective and policy?
Okay. For me, coming from the COVID-19 area, COVID-19 area has taught us many lessons. One of the lessons was that a pandemic can strike at any time, and you need to be prepared as a country. But the prevailing situation that we are having now is that in each and every country or that we have here in the ECSA region, there is a complaint of a shortage of skilled workforce. So for me, like I have said before, that it showed the countries that if you invest in nurses, because nurses and midwives, they stay with the patients 24/7. They are with the patient 24/7. And the work that they did during the COVID-19 was so stupendous, such that even the governments at that time, I remember I told even my association this side to say, you know what, this is the opportune time for you to go bargain with government, because everybody is regarding you highly this time, because they can see your work and the positive outcomes that are coming from what you are doing. So for me, I think if we can invest, governments can invest in nurses and midwives, there is a lot that countries can achieve. Yes, there is a lot that they have achieved even from time immemorial, even before the COVID-19 and the HIV pandemic, which we have realized the 95, just because nurses were roped in to manage the HIV pandemic. But if you remember very well, in the beginning, it was only the doctors who were managing the HIV, and they realized that they are not winning the battle. So they roped in the nurses. And even before that, even in the 90s, there was an outbreak of typhoid. Typhoid at that time, it was very critical that you respond, and you respond quickly and professionally. And the nurses came to the party, and they were able to do that. And so that is why I say, if we invest in the nurses, in the training of nurses, and also we invest in our unity as a nursing profession, you bring back the quad concept, because once you are united as a nursing profession, nothing can beat you. So I think that is what we are saying, to say, let us come together as government, as partners, as policymakers, as nurses association, as regulators and academicians as well, and of course ECSACON, so that we prepare these nurses and request our partners to come on board, assist in the training of these nurses, and ask governments to invest in the training of nurses, and also in the capacity building, and those in service to continue with their professional development. Because as ECSACON, we are providing CPDs which are very free, and we are providing webinars which are very free. So it is for that we think that ECSACON has done marvelously well, and there is room for improvement, with there is still a long way to go. And probably maybe to add one of my ambition. I think, I don't know whether it's an ambition that will not be realized, but it is one of my ambitions that, yes, we are saying ECSACON is a college without walls, but I wish we could get out of office and have ECSACON offices in place. And if we work together, I believe we are going to have our offices in place before 2026. Thank you, George. I submit.
Thank you so much, Madam President, for that powerful submission. I see there's a lot of excitement. Some hands were up. I would urge you that you just hold on your horses. You'll be able to throw your questions to Madam President at the end of the panelist submissions. And also, you can also use the chat box to just throw in your questions so that our colleagues would be able to pick them up and pass them over to Madam President, who will be able to respond to them during question and answer time. So allow me to take a step further and go to our next panelist, who will be able to just take us through a little bit of more that ECSACON does. So our next panelist is Elizabeth Oyuer. Elizabeth Oyuer, you can put your mic on as I do the intro, the video on as I do the intro. So Elizabeth Oyuer is the current registrar for ECSACON. She's a nurse with a lot of experience, having worked for International Nurses Council representing Africa. She's established, she's been able to achieve a lot along her career path. For example, establishing a nurse database with the Emory University and CDC, and she's been able to be part and parcel of updating of qualification of thousands of nurses that have been mentored and had passed through several regulatory bodies across Africa. So we are having a set of discussions with Elizabeth. Maybe Elizabeth, you can, if your video is on, you can say hi to the participants. Then we move to the next questions.
Thank you, George, for this opportunity to speak to the nurses and midwives of the region and other health workers. Hello, everyone. Welcome to this webinar. It's such an important one as we commemorate the birth of the founder of modern nursing, Florence Nightingale. So I want to welcome all of you. We celebrate you as ECSACON. We know without nursing, there is no health. So we celebrate you, we appreciate you, and we appreciate your time this afternoon. Allow me to switch off my video. The internet is very unstable, so that then we can be able to hear each other. Thank you, George.
Thank you so much, Elizabeth. So as we take a deep dive into key issues of the day, just tell us your mind in terms of how can ECSACON support the transition of newly graduated nurses and midwives to professional practice. It's one thing that somebody who is here who would want to join ECSACON looks forward to, and particularly in the underserved areas. And what are specific initiatives is
Thank you, George, once again. Many of us in this call are nurses and midwives.
Yes.
And we know very well that when people are in college, many, particularly those who are doing courses at degree level, the contact hours with the patients in the wards or in the community are not a lot. And so when you graduate, then you need people to hold your hands and be able to show you the ropes. That process of transition from being a student to being a qualified nurse going into, or midwife going into work, can be very stressful. And so we need to have mentorship so that we can build competence and also build confidence. Let me start by saying that ECSACON cannot do this alone. ECSACON works with a Quad Plus in our areas to introduce graduates to the real world. And who is Quad Plus? Quad Plus are the 4 pillars of nursing, which is regulations to do with the councils, associations, which are welfare bodies. Then we have ministries of health, which are who are in policy making, and also departments of education or higher institutions of learning. But we are saying quad plus because even the 4 cannot do it alone. We still need our partners that we work with, the WHOs of this world, the PIGOs of this world, the other partners that work with us to make sure that we bring in a fully rounded nurse midwives. Education institutions, therefore, address the theory-practice gap. In many of our countries, we have a curriculum that we follow, and normally education institutions and the practice area, they work together, but sometimes we do not. So people in the practical areas will be going for conferences and conferences, so they have updated their way of thinking and their way of working, and in education, they have been left out. So that theory practice gap can be filled by all of us, but particularly the education center. Professional associations, which are our welfare arm, are normally very useful in organizing very well conceived induction or orientation packages. In Kenya, we did that quite a lot. We are still doing, not to the extent that we used to do, because that time when we qualified, then the jobs were ready. So we went for orientation and we then went our separate ways. But now things have changed a little, but that's a debate for another day. We also, as professional associations, we also involve our young nurses in association issues so that they learn it from the beginning. Yes, they learned in class, but now it's practice. Then they also provide opportunities for CPD and also for advocacy. Advocacy, because it is the welfare associations who normally really advocate for us to have better working environments, what ICN calls positive practice environments. Regulators approve sites for internship, particularly for many of us. When you finish your degree program, then you go for internship before then you can be employed. So it's the regulators that approve those sites. And then they also provide evidence for change. Like if you put the norm, staffing norms 1 to 6 in the general ward, 1 to 1 in ICUs, then it's the regulator that then speaks with evidence so that even the policymakers can take it in. Policy or the leaders also ensure that we are employed and deployed appropriately. And where we are deployed, then there is room for supervision. I know all these people that I've mentioned, they do much more than this. But because George gave us some few minutes, so I'm just brushing through. So generally, then we have mentorship and supervision that should go throughout so that we inculcate work culture that supports equity, respect, and safety. Yes, colleagues, I'm sure you are lifting your hands, you are saying, but she doesn't know that there are challenges, we are so few, we can't mentor, we can't teach. And we know those challenges are there, and we need to have conversations about those, because those challenges are then making our young ones try to just study and go abroad as fast as they can. And that time will not even have taught them or even taken them through opportunities that exist out there. To what has been done by ECSACON, and I want to speak about Kenya, because that's where I live, that the ECSACON Kenya chapter embraced the students and novice nurses as members with equal rights, that except they are not being elected. Yes, novice members are being elected. We have some very young ones who are serving in the executive, but the students are part and parcel of us. When we have conferences, they come, they're able to present, they're able to see where do they want to go. They're able to admire the older ones like us and aspire to reach where we have reached. So intentionally, we also started by engaging a young nurse in the ECSACON Kenya office so that they can be able to be talking to the nurses, knowing what they want, what is it they need to do. And that has lifted them, catapulted them to another level. And so by doing that, we have exposed them to the real world of global nursing. So you'll find our nursing and midwives, the young ones, in midwifery associations, in global public health nursing, in International Council of Nursing, in our conferences. They are in the real world, and that helps them. Then we've also given them opportunities for mentorship. Like if somebody says they want to undertake research, that their passion is in research, then we are able to get our faculty from the universities to work with them so that they do researches. If their passion is in leadership and management, the same, and clinical practice, the same. So we are working with them, we are holding their hands, and we are going together. And George, I'm not saying that we are perfect, but that's the journey that we all need to take if we want to prepare the next journey. I submit.
Thank you. Thank you so much. Thank you so much, Madam Elizabeth. I just wanted to something like if you can have, what is your rallying call to that young nurse who has graduated, who perhaps is still looking up for ECSACON for skills and competence? I know you just touched quite a bit of it. What is your rallying call? I know we'll be able to give you time to do parting shot during question and answer time, but just a little bit of rallying call to that young nurse graduate who has just graduated and is looking forward to ECSACON for skills, competencies, and confidence to be able to move from level point A to point B in the nursing career.
My rallying call is that the future is bright. ECSACON was started in the 90s. Our motto is professional excellence. And because of that, now we have introduced even the fellowship programs that my two colleagues have talked about very, very clearly. And we have introduced them so that we prepare nurses and midwives who are able to function at very high levels. They are advanced practitioners who are able to be on their own, advanced practitioners who are able to be consulted, sit at the table with the other colleagues, so that then nursing and midwifery moves to the next level. And to do this, we have engaged a lot of preparations, and the preparations we did top-notch curriculum that can be used across the region. And so they are able to move up and down. They can work in any country. We have also engaged top-notch lecturers or faculty who are training the nurses. The content has been developed by subject matter experts. We are doing things legally, and so the clinical sites have been assessed and approved for training. We have trained master trainers, and we are in the right path. Right now, we are having 10 students already going on in our colleges, in our college, and we are hoping that, like I said, the future is bright. And where do I see? Let me add to what you even asked the president. Where do we see ECSACON in the next 10 years? We are seeing ECSACON embracing technology more and more. Our students in the first year, they are doing virtual learning, but we have face-to-face or some virtual also facilitation weekly. We have really prioritized HRH, and I want to tell the young nurse that opportunities are available out there, either in the countries or outside the countries. They only need to work and walk with us so that then we take them to the next level. We are ready and capable of taking them to the next level. I submit.
Thank you so much, Madam Elizabeth. I see we are progressing well. Allow me to introduce our next panelist, and as you are seeing on your screen, we still have 2 more to go. Allow me to introduce Dr. Ben Akamat Ryan, who is a neonatologist by profession. She holds a master's in public health and is a board certified in pediatrics and neonatal medicine. So currently she's serving as the head of global newborn and child health at the American Academy of Pediatrics, where she also oversees neonatal and global health initiatives and clinical skills and trainings. Dr. Ryan research focuses on outcomes of post-implementation of helping babies breathe, with over 85 publications highlighting her contribution to neonatal and pediatric care. She's a member of International Liaison Committee on Resuscitation of Neonatal Context expert group. So I would allow her, let me just stop sharing to allow her to put on her video so that we go to the discussion proper. Welcome, Benna.
Thank you so much for having me, George. It's really a pleasure to be here with all of you and to celebrate the contribution of nurses and midwives to healthcare.
Thank you so much. So we are still into the crux of the matter, and we wanted your perspective on areas of collaborations between, what are the key areas of collaboration that you are seeing ECSACON can take advantage of, especially with regards to collaboration proper between ECSACON and stakeholders in the health in industries, things that can lead to tangible improvements in patient care outcomes, tapping onto your experience and vast knowledge in the area of neonatology. What would be your perspective? We are really glad and humbled to hear your perspective on the same, in terms of how then do we enhance nurses' capacity in terms of building partnerships and having partnerships that matter most in healthcare industry. Dr. Benna.
Thank you. Well, I have to say that I agree with so many of the things that my esteemed colleagues on this panel have already said. I think we have to remember that in healthcare, it is a team effort, and we all have to work together in order to improve care for our clients and our patients, and to improve care for mothers and babies. And so we try to be very intentional in when we are doing programs or courses, or we have project advisory groups, that there is nursing voices or midwifery voices that are included in those groups, because we do healthcare together. It's a group, it's a team effort. And so we need to have all of those voices in the room. I think we also have to be intentional about how we build leadership. And we need to remember that the mentorship piece that my colleague Elizabeth already mentioned, and how we are growing the leaders of tomorrow, and bringing along junior colleagues and lifting them up so that they can assume leadership roles in the future, is really important. The AAP has had the pleasure of participating in a health system strengthening project, for example, in Ghana, where we have been working with an organization called Kabeli to improve referral patterns and the quality of care in the NICU. And what you see in NICU care, not just in Ghana, but in my experience working in multiple places around the world, is that nurses play a very critical role in how we elevate that care. They're the ones at the bedside, for the longest period of time, really interacting with mothers and babies and understanding the needs of those patients. And so we really need to make sure that we're listening to what their voices are telling us, that we are partnering together to improve care, and that we're practicing together, doing simulation together in how we're improving care. We have been really excited to partner with ECSACON on a project to disseminate the new WHO Essential Newborn Care training, which is very much based on the AAP Helping Babies Breathe program. And so one of the things that we've been working to do is really empower the nursing facilitators and leaders that are going to continue to disseminate this training. And beyond training, we know that we need leaders and champions that are going to continue to encourage health system strengthening after that initial training happens. And that requires another level of leadership, where you're really leading the change on quality improvement, behavior change, and how people are going to improve care. And so we really need to build on those partnerships with nurses and midwives to continue to improve care.
Thank you so much. Thank you so much, Dr. Bena. I'm just wondering, and perhaps you are in a better position to kind of highlight this further, and looking from outside, because outside inwardly, what would be your perspectives in terms of how then can, based on the partnership that you said you are currently having with ECSACON, and perhaps opportunity for more partnerships in future, how can ECSACON advocate for policies that prioritize appointment of nurses and leaders to strengthen nursing leadership throughout health systems to create sustainable nursing leadership roles where they are needed most?
Well, I think you're already doing a lot of those things. I think we are in the period now where I think we're recognizing that we have to work as teams. And so elevating the voices of all the individuals on the team and really creating a culture where it's not top down, but it's really, we are all at the same level and that we all should feel empowered to speak up for quality of care and patient safety. Those are things where we want voices of nurses and midwives to feel empowered to speak up to improve care. I think partnering intentionally with groups that are going to invite and elevate the voices of nurses and midwives. And I hope people will see that the AAP is working really hard to do that. And we are proud to partner with you on the projects that we have, and we would look for future opportunities to partner as well. And I think continuing to work on mentorship, as my colleague Elizabeth mentioned, she talked about supportive supervision. And I think really ingraining that kind of training, not just content knowledge, but also leadership training in all of the career points along the way, I think really changes culture. So, I think ingraining that in areas where nurses are learning the basics of nursing and incorporating leadership training in those aspects as well. I think together we're changing culture to really appreciate that all members of the team have a voice, and that voice needs to be respected and elevated and appreciated.
Thank you so much, Dr. Bena. I think we are fairly empowered with your contributions, and I know there's a lot of excitement about what you have to say. So we are just kind of testing as we're waiting for more questions from the floor, and I hope you are at hand to be able to answer them when they come. So colleagues, allow me to introduce our next panelist, who is Dr. Bupe, who is going to take us through the critical phase of this discussion. And at this point, maybe Dr. Bupe, you put on your camera, you put on your video as I do the intro. So we have Dr. Bupe. Yes, thank you so much. So Dr. Bupe is a maternal child health specialist with quite a lot of experience, about 18 and above, working across several roles in Australia, South Africa, and Zambia. She co-founded the Newborn Support in Zambia, advocating for neonatal care. She has been able to be included and awarded several awards in leadership in midwifery, and with a PhD in midwifery, she is also focusing on advocating for delayed cord clamping to reduce anemia, and also she's committed to improving healthcare workforce ratios, and our expertise spans across health program evaluation and quality improvement. So matters quality, Dr. Bupe for you, matters evaluation, Dr. Bupe for you. So for the purpose of this discussion, we are going to have a little bit of deep dive into the topics that had been that we had started talking about with the three panelists that we've had on board. And one of the questions that I would want to pose to Dr. Bupe is fairly straightforward. As an active member of ECSACON, what opportunities do you foresee the college do to better support the professional development and also career advancement of its members? I would want to hear your perspective of this, cognizant of the fact that you have quite a regional experience and regional touch in terms of what needs to be done. So I would pause there and let you weigh in on that, Dr. Bupe.
Oh, great. Thank you very much, and greetings, everyone. And so, yeah, so having been an ECSACON member for a long time and having benefited like from like conferences and a lot of trainings that they provide, I think what ECSACON is currently doing is something that every nurse should take advantage of, like the opportunities that are there for learning. And, you know, as we are advocating for us nurses being evidence-based practitioners, it is something that is extremely important, and it's an opportunity that ECSACON is offering. So I would urge every nurse to get interested in what is happening with ECSACONM and be part and parcel of the professional developments that are happening. And other opportunities that the college can do include like having visiting professors and visiting lecturers, and having exchange between nations, because the member countries can benefit a lot, like learning from each other. And probably one thing that ECSACONM can spearhead is having a curriculum that is a global curriculum, especially with regards to nursing and midwifery. And so, as alluded to earlier, like many speakers have already mentioned, with regards to the importance of nursing as a backbone of any health facility, one thing that we need to ensure, even as we are creating curriculums, is aligning the curriculum to the global content. And so, having trained in Zambia and South Africa, and now an educator here in Australia, there are differences that we can learn from developed countries with regards to advancement in the profession. And so probably we need to include and strongly, I would strongly recommend that ECSACON can spearhead programs like community midwifery and community nursing, so that nurses can be able to work in communities, and they need that support throughout the training. Like for midwifery, one thing aspect that needs to be embraced in our African curriculums is continuity of care, which is not very much strong. And it's from continuity of care that community midwifery and midwifery group practices and private practice in midwifery is usually strengthened. So we need to tap into what is happening globally and how we can advance our profession further with regards to a lot of other opportunities that we can undertake. And so I just feel like ECSACONM has got a very, very strong a link with regards to the ministers. And so probably in decision making, we'll probably, once they go to give a report to the ministers with regards to the advancement in nursing and midwifery, it's very important to ensure that we are talking about advancement that are happening and aligning everything else that is happening globally, so that once we graduate, our nurses and midwives, they can be able to work everywhere whenever their services are needed. And so those are the things that we need to look into. And so remember, I've mentioned already the issue of having visiting professors and lecturers from within the African continent. Like there has to be that exchange of information, and even like exchange of knowledge between colleges and institutions. And so it's extremely important to ensure that we are training our nurses strongly with regards to research, so that they can embrace evidence-based practice for better outcomes of the patients and the women that they are caring for. And so one thing that you would like to talk about is looking back at where nursing is coming from. As somebody who has undertaken philosophy of nursing, I would actually urge every nurse in this 21st century to write their own philosophy, so that they can be basing on that whenever they are caring for patients. So as we are talking about evidence-based practice, we expect every nurse to be interested in research, and even curriculums should be very strong with regards to research, so that nurses and midwives can come out of their training as evidence-based practitioners. Thank you very much.
Thank you so much, Dr. Bupe. I think this is fairly eye-opening, especially for colleagues who have joined here, who would want to be members of ECSACON or who are already members of ECSACON. Something that has consistently been mentioned from Madam President to Madam Registrar to all the panelists is the issues of nurses having to have a clear regard for research, and then evidence-based practice, and also now there's a new concept that each and every nurse must have a philosophy. So looking into that, even as you wrap this, would you just give us a little bit of highlights in terms of engagement and involvement of members? Your thoughts about probable initiatives that ECSACON can take advantage of to just make sure that that constant engagement between its members is top-notch.
Oh, great. Thank you very much. So probably some of the things that ECSACONM can start doing is offering of scholarships. And, so once somebody subscribes and becomes a member, there has to be those privileges of having probably a discount to programs and even conferences, which has been happening, because when you're registering for a conference, if you're a member, you pay lesser than somebody who is a non-member. But again, there has to be those other incentives like scholarships, and even just a provision of probably recognizing the people that have been in ECSACON and their strengths, and tapping onto what they are able to do. And so it's something that is extremely important. And one thing that can also be undertaken is ensuring that we continue working together as ECSACONM, like the countries that are part and parcel of the college, and then visibility, which is extremely important, like trying to ensure that all countries are visible in their own countries and they're able to recruit. And then whenever we have a conference, like for like a conference for all the members to come together, there are those opportunities where people can present their work and ensure that people are being recognized, and sharing of knowledge and webinars and conferences, and even just having like a time where we can just have a question and answer session so that we can address issues that pertain to practice. And so the other thing that ECSACONM can do is to ensure that they strengthen, especially with regards to the ratios. I always talk about quality improvement, and I'm passionate about that, and I always tell people that numbers matter. So ECSACONM can help strengthen that talk within the member countries, so that we can start sticking to the numbers that are required, because most of the time when we're working in our hospitals, you find that you are the only, if you're working in a hard to reach area, you are the only person, you are the everything. But and then like there are a lot of things that happen with regards to the burnout, and how unsatisfied it becomes because you're like completely burnout. And so we need a system, we need ECSACON to ensure that they are spearheading the talk with regards to numbers in practice. We need to be abiding to what is recommended in order for us to actually improve the quality of care for the patients and the women that we are managing. Otherwise, the current state of affairs is that we have abnormal numbers in many of the hospitals, meaning we're working beyond what is recommended. So like, for instance, if I'm working in the neonatal intensive care unit, the levels of care that for level 1, which is the very ill babies, not the very ill, the ones that have recovered. So we have 3 levels. We have level 3, level 2, and level 1. So level 1 is like a low dependence unit where a nurse or midwife can have a maximum of 3 babies, but that is not what is pertaining in our hospitals back home in Africa. And like if you're working in high dependence unit, again, 1 to 3 maximum, and then when you're working in level 3, it's 1 to 1. But what is pertaining is totally different, and I think it's a voice that needs to be strengthened by ECSACONM in trying to ensure that people are engaging in the activities that are happening, because once we are able to listen to the concerns and the demands of the nurses and midwives that we represent in the college, we are able to actually win a lot of people. So we need to have that niche with regards to what we are spearheading. And so we need to listen to the concerns and the cries of our nurses and midwives. And one aspect that probably ECSACON can actually spearhead again is the issue that is in our countries in Africa, where we have a lot of unemployed registered nurses and midwives. And so this has been a thorn in my flesh, because looking at the ratios in the wards that are abnormally low with regards to the nurse-patient ratio. And then we have a lot of unemployed nurses and midwives. So we need people that will be able to create the demand with regards to the nurses. And so we already have the demand. And so we need governments to understand the importance of having the correct ratios in quality improvement. And so ECSACON can strengthen that voice. And then the issue of community nursing and midwifery, COVID showed us how important it was to have nurses and midwives out there in the community with the people. I know we have public health nurses, but I don't know how far they go with regards to managing of conditions. So it's something that we need to strengthen and ensure that we have created a demand for nurses and midwives. Thank you.
Thanks so much. Thanks so much, Dr. Bupe. I know passion can make you talk about this, and I believe that our participants are also excited to shoot questions to you. So without running the risk of repeating myself, allow me to introduce our last panelist, who is Dr. Olsina Buru. Dr. Olsina Buru, if you are able to put your camera on. Dr. Olsina? Yes, we can see you. We can see you. Thank you so much, Doc. Thank you so much. Thank you so much. So Dr. Olsina is a registered nurse, midwife, senior lecturer at the University of Eswatini. She specializes in midwifery and neonatal nursing with vast experience in midwifery education, practice, research, and she's committed to advancing midwifery education and providing quality maternal care. She has played significant roles in developing curricula for midwifery training programs. She's authored chapters in midwifery textbooks that are being used in several of our learning institutions across the continent. And she's also served in leadership roles in international programs, and also serving as a guest lecturer in midwifery fellowship programs, showcasing her expertise and dedication to the field. So, Dr. Olsina, without running the risk of repeating ourselves, because you are more or less speaking toward the same thing as Dr. Bupe, what would be your perspective on key things that, as a member of ECSACON, you've been able to see ECSACON achieve over a period of time, and what would you suggest as a member of ECSACON to the ECSACON leadership in terms of where would you, for example, as the consumer of ECSACON services real time, what key perspective would you be able to share with the ECSACON leadership as well as the ECSACON fraternity?
Thank you, George. Good afternoon, colleagues, and good afternoon, everyone. As I'm already introduced, I'll try to focus. I thank you so much for zeroing in my task, because it was almost similar to Dr. Bupe. Fortunately, I'd also developed in such a way as one of the members who experienced ECSACON at the beginning, when it was only focusing on nurses, not yet including the midwives. And when it started, I'm so excited that it is where it is now, because it was like a white elephant and we couldn't understand how does a college come without walls, and we couldn't understand what was happening. But now it's shaped up and it's in a direction. So the way I looked at the question which you've just posed on me, see, initially it was similar to Dr. Bupe, but now I have to zero in on what everyone has said. And fortunately, I can zero in on that, also tapping on my experience in ECSACON. I've actually acknowledged all the linkages, the collaboration and the mentoring which is needed in the nurses. But what I'm seeing, which we need to actually improve on, which Dr. Bupe has mentioned on, is the membership. We need to speak to the ordinary member in ECSACON, who is the nurse and the midwife, to say what is in for her, why should she be a member, and what is her role in the development of nursing, midwifery, and education. That way we will be able to do a bottom-up approach as well, and to get the evidence on the real needs on the ground. So my first point would be to create awareness and sensitization. Yes, we have created awareness, and I'm happy to say we have actually gone a mile in actually increasing the membership, but we can do more. And we also need to sensitize them on what is it which is in for them. What is their role? Is it just to sit as members or to participate in the improvement of the development of the nursing and midwifery professions? So in that area, I want to take you back to say when it was initiated, like what the president has said, Madam Dr. Glory Msibi, when she mentioned about the beginning, where it was initially like focusing on primary health care. But we now know we have primary health care, which is preventive, which is health promotion, which is curative, and which is rehabilitation. This is in all the spheres, both in nursing and in midwifery. And I want to applaud what Dr. Pupe said about community midwifery, being in the communities. We are in the developing world. Since we are in the developing world, we are also developing, and we are actually having strides, which we have made, because we start in the communities. We do have curriculums in certain countries which focus on community midwifery. But the challenge, because of the limited resources, we cannot develop community midwifery as a profession because of the challenges of financing in both training and sustaining them. So this is one aspect which ECSACONM can look at, considering that it works with ministers of health and in government. So that collaboration needs to be strengthened, because we do have a situation where our nurses have very strong strength in primary health care because they're the first people which the community sees at the facilities, and they have to provide primary health care. And they have done that and they are there. But because of the limited resources, we still have the limited number of nurses and midwives who can provide that. At the same time, we can't increase the training because we don't have the finances. Therefore, we need to look at how can we finance that. Apparently, we have challenges with most of our partners who may not focus on that. But as ECSACONM, we have to motivate and to advocate for that. Then at the same time, there's an element where we were talking about the economic care, health economic care in the people. You find that in the HIV/AIDS program, it is the nurse who actually contributed to improving the health of the people and the communities where we reduced the number of people dying from HIV and AIDS. And that was actually a cost-saving measure, which was spearheaded by nurses. We also have the recent COVID-19 pandemic, where the nurses were the front runners. And at the end of it all, the nurse was not recognized. So we need to look at such issues where the nurse does the perform and there's not much recognition, so that we motivate the nurse, and they also realize that they have a responsibility to improve the care which they provide. So my main point, which I'll contribute to this session, is coordination and collaboration. We do have our partners, so we need to improve or strengthen our coordination with them and use evidence to request for support. Currently, we have heard our leaders talking of the programs which have been put in place. Those programs, they need mentoring. They need linkages, for example, with the tertiary institutions for support. But as much as we are looking at that, we should also look at the development of the capacity of those academicians. We are having young people joining the academic profession. So we need also those young people to be mentored. Over and above that, we also need the strengthening between the academicians and the clinical area, which has already been mentioned. So we need to improve leadership in both aspects so that they identify the areas of collaboration and they coordinate the service to allow the student to gain the necessary skills. We know that both in nursing and midwifery, we have the competence-based curriculum. That needs skills development. Therefore, we also need our partners again to identify those skills which needs to be enhanced or improved so that we can improve them. Then we also have the linkages, as I've said, I think it's the president who mentioned it, where there should be linkage with tertiary institutions to bridge the theory gap. We do have the theory gap. The advantage which we have is at least there are researchers. And I'm happy that we have the research portfolio in the ECSACONM, where we need to also capacitate everyone, even at the lowest level, to be able to utilize statistics so that they put those statistics into action. They need to convert them into data which represents the need for the care which should be improved. My last point is on the Nurses Association and unions. We need them on board from the lowest level up to the highest level, which is the secretariat. We also need to engage them in country so that when we go and advocate for care or for better services or conditions of service for nurses and midwives, we have them and we use evidence. Dr. Bupe was talking of the staff-patient ratio. Yes, we need that knowledge at the lower level so that we justify the work which we are doing using evidence. And then we also prepare for where can we get the help to meet that. Because we should also not forget the developing countries. This is why we need partners. Let's identify those partners which can help us to enhance or improve our countries and build the economy of the country. Because when there's good health, we know that there's also the cost of the finances for the country, they will improve because money will not be diverted to the treatment of the people, but rather to prevention. Thank you.
Thank you so much, Dr. Oslina. I think we have had a very fairly interesting contribution from the panelists and enriching contribution from the panelists, and I believe that our participants are excited to shoot a question here or there. So I would just want to give a small window of time for our participants so that you are able to shoot in your question. We had requested that, for example, if you have a long question, you can place it on chat. Maybe in Nabina, you can check if there's something on the chat. But the floor is open for just a brief window of time of about 3 minutes for question time. So if you are having a question, you can raise your hand, come off your mute, and then you pose a question to either of the panelists.
George, maybe I can begin. I see some two questions in our Q&A chat.
Okay, thanks.
Start with Rose Patricia Oluov has asked, thanks to all the panelists for sharing those insights. I am glad Dr. Bupe has addressed the questions of nurse-patient ratios. This impedes quality. Madam President, can this discussion find its way to the Council of Ministers meeting for a more deliberate stand for countries to commit to and for improvement?
And
Madam President,
we had already typed the answer to that question. Maybe if we can just read it through, so for everyone to be able to see it if they did not, but she had already shared the answer, saying that thank you, Kale. As ECSACOM, I think we can advocate.
Nina, apologies. This is a different question to the one for Kale.
Okay, perfect. Madam President, are you able to?
Yes.
Yes.
Go ahead, George.
I'm asking, is Madam President on? Then she can be able to respond to the question we just read if it's different from what the one in Nabina is reading. Madam Glory, Dr. Glory, yes.
Thank you very much, George. I think I have already responded to the question, but for the benefit of those who have not seen my response. I mentioned that maybe as ECSACON we can, because there is a Council of Ministers meeting that is coming in June. So that is where we are going to be presenting some of the things that have been presented here, which we have already noted. And the issue of staffing, it's one of the key issues that we need to present to the Council of Ministers. However, again, I think there we need also to present that with evidence. I remember here in Eswatini, we once developed the staffing norms, because you need to have evidence to say, yes, there is shortage, but how much is the shortage, you know? So we developed the staffing norms. So for us, maybe it would be to encourage the countries to have those staffing norms in place and be implemented in the various countries. Because if you give a ratio to say a ratio should be 1 to 3 nurses, in some areas, that ratio cannot be implementable, because maybe there would be high volumes of patients who are there, and you just cannot. So for me, I think we need to encourage the countries to come up with the staffing norms and implement those staffing norms. And of course, the directors will be represented in that meeting. So it would be good for us to make it known that the members of ECSACON, this is what they want for the countries in the region. Thank you very much, George. I submit.
Thank you so much. Wairimu, you are reading another question?
Yeah, I can read one more before maybe we go to some raised hands.
Yes,
So what is ECSACOM doing to make nursing schools have same curriculum in order to avoid retraining nurses when they relocate to the other countries?
Yes, Madam President or Elizabeth, or whoever is going to take that, that could be a...
Yeah, I could give a short answer and start with the fellowship programs that we have one curriculum for each technical area. One curriculum for chronic disease management, one curriculum for midwifery, one for everything that is coming. And so it should be okay for the fellowship programs. Earlier, we had embarked on a harmonization program, and that ECSACON came up with a professional regulatory framework. That's the framework that all the countries in the ECSA region are using to develop their scopes of practice, their standards of practice, their standards of contact, and so on and so forth. So if that was properly done, then we would not be having a lot of differences. Of course, we know curricula, many times, many countries add something that is peculiar to them, but there has been an attempt to do what you have said. Thank you.
Maybe let me come in again, George. I think this is also one of the valid questions that has been asked. But I remember, I think I was still in regulation. WHO took us to Burkina Faso, whereas East Central and Southern Africa countries who went there to look into the curriculum in a state or in a way of standardizing the curriculum. So we were working on the competency curriculum. So in most instances, the curriculum, when you look at the curricula, the basic things, they are the same, which are required by the regulatory bodies. And as Madam President, Registrar has said, to say there are some things which are peculiar to that country. Take, for instance, malaria. In East Africa, I guess You cannot be a nurse if you cannot manage malaria. You need to know how to manage malaria. But in some other countries where malaria is not an issue, maybe malaria can be taught, but not in that volume which can be taught in East Africa. So in other words, what I'm saying is that even our basic or our basic curricula in our universities, the most salient things that are required to be included, they are there. Maybe it would be the way they are taught, but when you look at the transcripts, they are there. So in other words, WHO tried to harmonize the curricula in the East Central and Southern Africa. Thank you. I submit, George.
Thank you so much, Madam President. I saw some raised hands. There was Evelyn, or there was some raised hand that apparently now is lowered. If you can come off mute and proceed with your question. Yes, I can see Dr. Bupe is back with raised hand. Dr. Bupe, you have something to add?
Yes, no, so it's with regards to the curriculum. So having worked in, or having trained in Zambia and in South Africa, then came to work here, one thing that I've learned, especially with the way our curriculums are, I think it's very important to start aligning them to the global curriculum. Because like if you happen to come to Australia as a midwife trained in countries other than South Africa is the only country which is recognized with regards to midwifery practice. And so you cannot be registered because there are components that are missing. And so as we create curriculums, I think it's very important to align our curriculums with the global competencies that are supposed to be in the curriculum, so that people don't have to repeat, like if you're a midwife and you're passionate, if you're a nurse and midwife, they only register you as a nurse, and then you have to, if you want to work as a midwife, you need to go back and get trained to be a midwife in a country like Australia. So I think probably ECSACONM can spearhead that by ensuring that the curriculums that we are having are meeting the global standards, so that a person can be able to register everywhere whenever they want to go and work. That's my submission. Thank you.
Thank you so much. Thank you so much. Thank you so much, Dr. Bupe. I can see Dr. Oslina's hand is up. Maybe you just give in your comment and also your parting shot, because we are also running short of time. Just your comment and parting shot, Dr. Oslina.
Thank you, George. I'll be very brief. I wanted to comment on the curriculum. The curriculum, I think if we look at the strategic plan for ECSACONM, it has something on that. I think it will be a matter of time. And we thank you, Dr. Bupe, for sharing the international standards. And it's in the process of being looked at. And I think countries in Africa, they're at different developmental levels. And with the introduction of the fellowship and also the review of the curriculums and the writing, we are going to get there. So I urge all members to contribute to that strategic plan so that it becomes a reality, because it's according to international standards. We have the ICN and we have the ICM, and they've put standards for the curriculum, and countries are trying their best to meet those curriculum requirements. Thank you.
Thank you so much, Dr. Oslina. Dr. Vina, parting shot, 1 minute.
I would say,
yes, Dr. Vina. 1 minute parting shots.
Yeah, I would say that I think there's a lot of advocacy that ECSACON can do, and I think pediatricians are here as well to advocate, because I think we see nurses as essential partners in improving care. And so we look forward to the future collaboration to lift all of healthcare and improve the quality of care for mothers and babies. Thank you so much.
Thank you so much, Dr. Pina. Madam Elizabeth, 1 minute, parting shot.
Thank you, George. Let me take from where Dr. Bina has left, that we really need to collaborate, particularly in our technical areas, including neonatal nursing. We really would like to work with the neonatologists because neonatologists are so few in our countries. So if we have the specialists from even other fields, we'd really love to work with them. And secondly, I'm just urging all the nurses and the midwives, those who want to take the courses in the areas that we have developed, please apply, enroll, and be part of ECSACON. To everyone, support your college by being a learner, by being faculty, by being a mentor, or just being a partner. Support your college. Let's be proud of this college. I submit.
Thank you so much, Madam Elizabeth. Madam President, Dr. Glory, 2 minutes parting shot, please.
Thank you very much, George, and thank you very much, the moderators, and thank you, Secretariat, the panelists, and the colleagues who are here listening to us and giving us points. We are very much grateful to the contribution that we have made, and we are noting most of the things that you have encouraged us to do, and we are pledging that we are going to take this forward and try to advocate for the things that we have submitted, and also to request our partners and our nurses to work with ECSACON so that we realize the dream of being the center of excellence. Thank you very much.
Thank you so much, Madam Glory. Thank you so much, everyone. I think we've had a very interesting and exciting, informative discourse and dialogue. And I believe that we are able to think through this as ECSACON and also organize such kind of roundtable discussions as frequently as possible. Food for thought for ECSACON leadership. And I think this is something that is going to be looked into. Allow me to take this back to Nina Bina to take us through the next bit of the program. Thank you so much.
Great. Thank you, everyone, for participating, for asking questions, and thank you to our panelists. That was a fruitful discussion. I have good news. As we end this event and commemoration today, I'd like you all to look into your screens and see that we are here to announce that we are about to launch our revamped or new website for ECSACON that will include more features that are member-friendly and that are with more causes, as we were speaking of, participating causes and fellowship and more of what we would like to offer. So stay tuned. We will definitely share with everyone who has joined in this meeting and everyone who's a member, and those who are after this session are going to apply and being members. So you're very welcome. So take your time to look out for our posters and look out for our new revamped website. So just to give you a glimpse of what will be part of this new website is a new way and a refined way of a payment methodology, but also there's other new features such as more causes into the site that are again applicable for new nurses, for seasoned nurses, and everyone who would like to join both nurses and midwives. But also this new website will have more news and updates that can support us into our learning and be updated with all that is going on into our region concerning nurses and midwives. Thank you very much. And to move forward, I would like to share with you that we are in all the social medias, including Instagram, Facebook, YouTube, LinkedIn, and Twitter via ECSACON. And please share, repost if you've been able to see and access. We've been posting the whole of week in celebration of the Nurses Day, but you can as well go to our website for your abstract submission, to register for the conference, to see the fellowship programs at www.exacon.org. And you can just send us an email if you're having any issues getting through that, or you'd like to get more clarification after this session or later on, under info@exacon.org. I'd like to thank you all for joining, and looking forward to, as we say goodbye to each other, why don't we take time to go into the chat and mention which country we are coming from and a goodbye in your language. That would be amazing. Thank you very much for joining. I will look forward to a fruitful discussion into our platforms. Thank you. Goodbye.
Nisale kahle.
Thank you, everyone. I can see Zambia, Kenya, Tanzania. Thank you all. Seychelles, Namibia, South Africa. Thank you very much. I hope we can all see the different languages and how to say goodbye in different languages. Thank you very much. In Rwanda, from the USA, from Zimbabwe, from Mauritius. Thank you very much.
Ilondoloze